Hi there. Thank you so much for checking us out here on our YouTube channel today for your medication needs and other medication related questions that you have. And as a way to support our community here at DamiRx Care, we do recommend you subscribing to our YouTube channel. Also, we would like to gift you for subscribing to our YouTube channel. And if you check the description bar below, you'll find a link where you can download a free diet meal that we do have here as you commence on your healthy lifestyle and habits. All right, so what is our medication of choice today? So our medication of choice today is Loratadine in combination with Pseudoephedrine. So the brand name for this medication is called Claritin D. So this medication is usually taken in patients who have allergies or patients who have nasal congestion, such as runny nose, watery eyes, sneezing, or itching of your nose, throat, or your eyes. So this medication does come in a 12-hour or a 24-hour tablet. And usually the 12-hour tablet, you would take one tablet twice a day. And for the 24-hour tablet, you want to take that one tablet a day. It's usually recommended that you take this medication earlier during the day. That way it doesn't keep you up at nighttime due to the pseudoephedrine that's in the medication that can kind of act as a stimulant. So this medication does come in a tablet. So it does come in a tablet form, and it's usually sold behind the counter in the pharmacy. So what are some side effects to look out for while taking this medication? So some side effects include fatigue. This medication can cause insomnia. That's why I said I recommend you taking it earlier on during the day. That way it doesn't affect your sleep when you're trying to sleep at nighttime. You know, in addition to you already having it like a cold symptoms, you want to be able to get, plenty of rest while you're taking this medication. So you want to take it earlier on during the day. All right, so this medication can also cause dry mouth, so you want to make sure that you're staying well hydrated. Those are one of the big side effects of this class of medication. Also, the medication can cause headache as well as dizziness. It can cause nausea as well as nervousness due to that stimulant from the pseudoephedrine. And this medication can also cause inflammation of the pharynx, which is also known as pharyngitis. So what are some things to also know, or serious side effects to also make sure that you're aware of while you're taking this medication? If you are taking any high blood pressure medication, this is not the medication for you. The recommended medication for patients who have a high blood pressure condition is the Claritin HBP that's sold over the counter. So this medication, due to the pseudoephedrine in it, can increase your blood pressure. So this medication is not recommended and should not be taken in patients who have severe hypertension or patients who have a coronary artery disease. Also, with this medication, you want to make sure that you're avoiding grapefruit juice, as this can affect how well this medication works in your body. Also, what are other things to look out for while you're on this medication? So this medication can cause insomnia, and it can also cause nervousness. So making sure that you're taking it earlier on during the day, as I mentioned earlier, in order to avoid this closer to bedtime. Also, for patients who are taking the 12-hour tablet, you want to make sure that you're taking that on an empty stomach 1 hour or before you eat, or 2 hours after you've had something to eat. Also, in patients who are taking the 24-hour tablet, you want to make sure that you're taking this with about 8 ounces of water. Regardless of if you're taking the 12 and 24-hour, you want to make sure that you're taking it with plenty of water to avoid that dryness or dry mouth effect that comes with this medication. With this medication, you do not want to chew, break, or crush the tablet in order to avoid this medication being absorbed too fast than it's actually recommended in your body. So you want to swallow the tablet as a whole, and in order for the medication to be able to work effectively. So for patients that are taking the chewable tablet of this, there is a chewable tablet available, but it actually contains phenylalanine. So If you do have any issues with phenylketonuria, then you definitely want to reach out to your doctor before taking this medication. So if you have been taking this medication and it's been more than 7 days and you're still noticing the symptoms, then you definitely want to make it to your local healthcare provider. That way they can make sure that there's no other condition that's causing that nasal congestion symptoms that you are having at that moment. All right, I hope I was able to help in terms of what to look out for while taking this medication. Like I said earlier, you want to make sure that if you are going to be operating any machinery while taking this medication, make sure that you've taken the medication for a couple of days and kind of understand how the medication works in your body or how well your body tolerates this medication before operating any machinery or doing any activity that will require for you to be mentally alert. Thanks for watching again, and please stay tuned.